So hello, I'm Adrian Richards. I'm a plastic surgeon and the surgical director of Aurora Clinics based here in the United Kingdom. This is second part of videos we're producing on breast reduction surgery, and in this video I'm going to be talking about the different techniques that can be used. Now essentially breast reduction, when it was first done, was performed by a lot of varying techniques, and one of the ones that used to be used is a technique called a free nipple graft. And this is basically where the nipple was removed, actually shaved off, removed. You could have walked out of the room with it and then placed back as a skin graft where the blood flow re-establishes to the nipple. Now that's not a technique we use anymore because it produces poor scarring and the nipple doesn't have sensation and you won't be able to breastfeed. So that's really a technique that's not used anymore. So free nipple grafting I think we can discount. Okay, so what we tend to do now is preserve the blood supply to the nipple on a bridge of tissue. So we need to preserve the connections of the nipple to the breast. So we remove the tissue around this, so the nipple is kept attached by a bridge of tissue which plastic surgeons call a pedicle. Okay, so the tissue around the pedicle is removed, normally from the lower part of the breast, and we always have it analysed just in case there are any abnormalities in it. So the pedicle, which carries the nerve and blood supply to the nipple, can either come from the top, the side, the outer side, inner side, or below. So pedicle from the top is called a superior pedicle, from the bottom, inferior pedicle, from the inner aspect, a medial pedicle, and for the lateral aspect, a lateral pedicle. So when you hear people talking about which pedicle they're going to use, it's just basically where the bridge of tissue that supplies the nerve supply and the blood supply to the nipple is based. Okay, so I hope that's clarified that issue. The next issue is the scarring that's going to be involved. Now, with a breast reduction, you normally, the nipple is lifted to a higher position. Okay, so there will always be a lollipop scar at the very minimum, which is a scar around the nipple where the nipple's been lifted up to, and a vertical scar down to the fold beneath the breast. In small breast reductions, there's a technique which has been popularised by Madeleine Lejour in France and Elizabeth Hall Findlay in Canada, which is called a vertical scar reduction. Okay, so the scar is only the lollipop scar around the nipple and down, and this is really only suitable for small reductions in probably younger patients. Okay, so if you're a bigger reduction in a slightly older patient, we need to add a transverse element to the scar, and that makes it into an anchor. So an anchor is the lollipop scar, the round scar, and then down with the cross bit as well. So that makes it into an anchor, and depending on how much tissue there is and how much big the reduction is going to be, that varies the size of the transverse scar. So you really need to discuss with your surgeon, number one, are you a candidate for a vertical scar reduction? Number two, do they favour an anchor pattern reduction? That's also known as a WISE pattern reduction, W-I-S-E, after the gentleman who invented that anchor, or first described that anchor pattern reduction. So you need to ask, what's the plan? Is it going to be a vertical scar, lollipop scar, a short transverse scar with a short scar underneath, or a full anchor WISE pattern reduction? So I advise you to ask those questions, and if you want to appear knowledgeable, ask them what pedicle they're going to use and what pattern of skin excision they're going to use. So I hope you found that useful. Please feel free to watch the rest of the videos in this series, which are going to discuss how you prepare to the operation recovery period, things that can go wrong. Thank you.